This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh, and we're going to be discussing bariatric surgery. It's one of the many options you have available to you when it comes to weight loss. We're going to be sitting down with Dr. A.J. Herrera. He's a bariatric surgeon here. What is bariatric surgery and what are the options available to you? Well, thank you for taking some time to join us today. We're talking about bariatric surgery, so let's just kind of get into the nuts and bolts. What is bariatric surgery?
Bariatric surgery literally is the surgical management of the severely obese patient population. The word bariatric comes from Greek. It literally means weight treatment. But to an individual's outlook on life, bariatric surgery is mainly just an adjunct to the lifestyle transformation that is really necessary and promoted for long-term success at weight loss.
Yeah. So I mean, we're talking about the people that would need this, definitely obese people. Are there other steps or treatments that people should try to do before using the surgical option?
Yes. Insurance companies are very strict with the criteria to get to and cover bariatric surgery. They usually put forth a number of steps that patients need to go through to get to the actual operation or surgery. Those include meeting with dietitians, meeting with physical therapists to go through rehab goals and protocols, obviously meeting with the physician in the office to counsel on the operation. And the other thing that's important is a psychological assessment. This is a lifestyle change, it's a lifestyle process, and these things that are set up in place before surgery are critical to both identify patients who will be successful at surgery, but also set up their expectations for post-op follow-up.
Yeah, so there's a lot that goes into before a person is actually approved and goes through that surgery. Who are the people that need this surgery?
Yeah, so back in 1991, the National Institute for Health set up the guidelines. They outlined them back in 1991. They were verified and reviewed in 2004 by the American Bariatric Society, so these guidelines have kind of stood the test of time. Candidates include adults with a BMI or body mass index, which is essentially just a ratio of a patient's weight over height. Adults with a BMI greater than 40, or adults with a BMI greater than 35 with a comorbid disease that was either caused by or exacerbated by obesity, sleep apnea, diabetes, high blood pressure. The list goes on and on.
Mm-hmm. When we say bariatric surgery, are there different options to the surgery?
Absolutely. There's a number of bariatric procedures out there. Here at Aurora, we'll be focusing and offering patients mainly two of them. Within bariatric surgery, procedures are classified as either restrictive in nature or malabsorptive. Restrictive procedures essentially are just making the stomach smaller to limit caloric intake. Malabsorptive procedures essentially either reroute or shorten the intestinal tract to decrease the effectiveness of nutrient absorption, leading to weight loss. So here at Aurora, our team will be offering a sleeve gastrectomy, which is essentially a restrictive procedure, changing the stomach from a bag to essentially a small tube to limit intake. And then there's a Roux-en-Y gastric bypass, which is kind of a combination of a restrictive and malabsorptive procedure where we're turning the stomach into a small pouch, but also rerouting the intestinal tract to help limit the effectiveness of the nutrient absorption as well.
Yeah, a couple different options there. Now, let's talk about what happens the day of the surgery. Kind of just take us through the day as a person would check in and then going through the procedure.
Yep, so patients would arrive essentially 2 hours before surgery to check in, meet the anesthesia team, meet the nurses in the operating room, be rechecked in by their operating surgeon, have the operation, which is a variable length depending on the procedure that's being offered them, and then being admitted to the hospital after surgery for approximately 1 to 2 days. After surgery, patients are kept on a liquid diet initially and then slowly transitioned back to regular food.
It doesn't sound like it's an outpatient surgery.
No, not an outpatient surgery. They do need to stay at least one night to make sure that their first meal, so to speak, those first few liquids actually go down fine.
Mm-hmm. And you have already mentioned this, but it sounds like it is not a one-time fix. You don't have the surgery and everything's fine. Right. There's also a lifestyle change.
Yeah, very important for everybody involved in the process, but specifically the patients, to realize that bariatric surgery is not a magic pill for weight loss. Bariatric operations will not be successful without long-term changes to healthy eating habits, healthy lifestyle, exercise, and motivated patient. That's key as well. We mentioned before the vast array of team members here at Aurora that are in place to help patients preoperatively and postoperatively. So it definitely is very important that patients understand that it's a lifestyle change, and the bariatric operation in and of itself is just an adjunct to all of that.
Mm-hmm. And I would imagine if you make those lifestyle changes, there's the chances of it of obesity reoccurring is lower than if you just say, you know what, I'm back to
Correct.
the junk food and everything else.
Correct. Our team and program here have instituted a program after surgery should patients kind of fall off the track and regain a little bit of the weight back. We have a specific program to recapture those patients and get them back on the right track. Okay.
How does insurance work with bariatric surgery?
Good question, interesting question. The CMS, or Centers for Medicare and Medicaid, officially recognize obesity and its treatment as appropriate for those federally insured. The insurance industry overall has kind of been slow to offer coverage of bariatric surgery for various reasons, but we have seen recently that more and more insurance companies are covering bariatric operations as more and more data and stats come out that treating obesity upfront and definitively can actually save money in the long term. And as we know, obesity is a big burden to our health financial situation in the country.
Absolutely. Well, you know, if somebody's wondering, you know, I'm heavier than I think I should be, you know, obviously you should be checking in with your primary care provider, but at what point do you start that discussion with you or your primary care provider in terms of, is bariatric surgery the right thing for me?
Yeah, we mentioned the guidelines, so patients obviously have to meet those guidelines to be recommended or a candidate for surgery. It's never too late or too early to start the discussion. And again, we have an exhaustive and dedicated team here at Aurora to help patients with whatever they need. If it's just information, we have a medical weight loss program if that's all that they want to look into or do. And then obviously those patients in that medical weight loss program can come over to see us on, you know, essentially the surgical side or their physician side if it's something that they want to entertain being a bariatric operation.
All right. Well, terrific information. We appreciate you taking some time with us today.
Thank you for the opportunity.
If you have tried other weight loss options and it just hasn't worked out for you and you think bariatric surgery might be the next step, give us a call here at Aurora at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.